think we'll wait on a couple of folks here as they're joining in. Thank you very much for being here. And again, I'm really excited to be spending GIS Day here in Harrisburg University. For me, this, again, is a very special day. It's an opportunity to really do some deep exploration of all the different types of applications of mapping. So I'll share with you kind of how I got introduced into mapping, into geospatial, and whatnot. So, as you can see, I have been trained as a physician, and so my introduction into basically everything in life was medicine. So, I was seeing patients, and especially in inner city areas, especially in Baltimore and other places, and I was seeing diabetes, not being under control. And so it was interesting to see that in some places, insulin and a lot of these therapies would actually be very effective, and patients would come back with controlled sugars. But then in other places, there were other factors going on. So it seemed like there was something pertaining to location. So I started looking at all these resources, and so my first instinct, being a nerd, is that I'll be looking for books. And so one of the books that I decided to dig in on was this, and big mistake. That I wasn't quite ready to look into all of the different complicated measures yet. So I decided to pursue public health to try to understand what is going on. I also saw that with stroke, right? There was actually geographic variation. So like within the South is considered the stroke belt. So what's behind that? What's going on there? So all of these unanswered questions, and I don't like unanswered questions. As an academician, I don't like that. So I decided to pursue further and get my graduate degree, my master's degree from Hopkins in geospatial. So I just went, all the way with that, and now, so I apply geospatial tools, and so I'm going to try to share with you some practical aspects and try to inspire you to go in this field. In this, really, I would say a lot of developments have happened within even the past decade, and especially with the pandemic. And so, talking about geospatial health, we have to talk about the pandemic, and the gravity and the seriousness and what it has done to communities and how it has affected everyone, And so the first part of this, instead of diving right into regression, I'll talk about the pandemic and try to explain how geospatial considerations helped and can still help us come out of the pandemic, So there's multiple messages going on here. So I'm trying to show, on one hand, how the health applications are, and so on the other hand, I'm trying to show, all the exciting things you can do with this. So bear with me here as I develop this story and try to show a little bit more. This is a graphic that I made. And one of the things that I do, one of the important things that I believe when you're communicating health, it's important to use language that everyone understands, right? So, I could have made it technical, but one of the things is that it's one thing to teach about health, but another to empower communities to improve health. And I believe in that. You can go, you can go and into a community and just say, okay, these are the tools that will be effective. This is what you need to improve healthcare access for all, for education. You can go say all of these things, but if you're not actually providing concrete sort of tools to organize data and say, okay, to policymakers, to lobbyists, to say, okay, this is what is happening in my community. This is what is happening in our community. And we have to be empowered, and so it's a joint effort. So geospatial, I'm making the argument here that geospatial tools are the wave of the future and will be the way that we'll be able to heal our communities recovering from COVID, recovering from the pandemic, because it's been devastating economically. It's been devastating in terms of the types of social isolation, in terms of loneliness that people are experiencing, mental illness, and even long COVID. And I've actually written and given interviews about all of these things out there. And so I've seen it. And so it's important for us to tackle at the community level health. So another model that I would like to share with you, and something that really, I think, resonates when we're talking about overwhelming amounts of data. So now I'm not only talking about geospatial data, but also just the overwhelming amount of data that is amassed just to consider geospatial things. So let me draw this model. So anything that you generate, right? Numbers, longitude, latitude, right? So longitude, latitude. I was talking about diabetes, right? So when you're thinking about geospatial considerations, then you're thinking about diabetes incidence, right? So incidence, prevalence. Are these familiar terms out there? Yeah. So these are typical measures that we are thinking about, right? When we think about the pandemic, or when we're thinking about typifying some sort of disease condition, right? Specific ways that we can do that. So, but you have all of these simultaneously, you have all of these real-time data, whether it's spatial trends, whether it's temporal trends, trends by time, you have all of this data. How do you make sense of it? Well, mappers, we make sense of it through colorful maps, right? But then, so how do we get that data? So the question here is, how do we get that data and translate it into information? So the next step here is information. So it has to make sense, right? So once you have information, then, and that can occur in many different places. That can be for mappers, that can be in the context of a map with a hotspot analysis, in terms of where there are areas of clustering and where there is not GEDIS or GI. There's multiple different types of tests to do that. But point being, we have to get from data to information. And so that simple model explains basically this whole talk. How are we getting all of this data, all of this superfluous, all of this data amassed and get it into information? So that puts into perspective. And then, does anybody know the rest of this? Data to information. And then from information, what happens next? Knowledge. Yes. Great. Okay, so, and this is where you're starting to interpret these, and you see the conclusion of these papers, of these scholarly peer-reviewed journal articles in geospatial analysis, and that's the knowledge that you're gaining. Now, knowledge combined together, meta-analyses, those of you who are familiar with that, a compilation of multiple papers would be creating, what's the next letter in that model? Anybody know? Wisdom. Yes. Great. Okay. And that is what I was trying to capture in this empowerment slide, where the person, is introduced, and this is how I felt. So the person is introduced into mapping, and they're just holding a globe like this, in their hands. And then after working, after a long time, the person becomes empowered, and the person is able to use that mapping skill to make a difference within their own communities. And that is our focus. The term globalization, right? It's not globalization anymore. It's the fact that we're fusing what is known, the wisdom that is coming out of our communities, with what we're knowing. So that is what, all of this is all about. So let's, continue on our journey here. And it had a little colorful changing it because of the dynamic nature of, messaging. So that's what I created. So, we'll be going over more about existing data sets and kind of demonstrating how that applies to cancer. And then we'll talk about some regression. I'm not going to go into too much detail about regression because that is something that, you can go into on your own. Okay, so again, the motion kind of helps to. So, all of this talk so far, I've been focusing on how you can convert, data to information, but importantly, how does this convert and translate into policy at the community level, right? And so these are some concrete steps, and this is where I'm going to start off, with that transformation, is that understand the need at the community level, right? Like, what is it at the local level that you need to address? What are the needs? Do a needs assessment, right? Involve community stakeholders while you do so that they feel empowered. Okay, so the second point that I made talks to that data. What is the data that is out there? That's the next question. What are you trying to focus on? And then what I did is I introduced, any of you familiar with Healthy People at all? One. Maybe some of you have heard it. These are national level objectives. If you get a chance, please visit this. Each decade, the Centers for Disease Control, other public health agencies come up with target objectives that need to be met on a national level, on a community level, all of these things. So these objectives, if you follow them and if you, and they show increases, decreases in trends, in terms of you can pull up ones on diabetes, other conditions. There's about 355 or around 350 for 2030, HP 2030. So there's a lot of updates that have been made. So please do, even if you've visited a long time ago, please do check them out because they help to guide sort of policies. And I would argue that in some ways, policy is where the rubber meets the road. That is where, I'm again, I'm a researcher, I'm an academician, I'm a public health professional now. I transitioned from medicine into public health, and so it's something that you really need to develop. So understanding geospatial principles from the pandemic. What did we learn? It's important that we understand how to characterize something like that in the future, because let's face it, Initially, we didn't think we were going to be in the pandemic this long to begin with, right? But it's just kind of continued, evolved. First you had the original, and then there were strains. There were the Delta strain, and so all of these mutations made it much longer, and so we're in a pandemic era almost, because there's also a lot more encroachment on natural habitats, and so it's really necessary that we look at geospatial considerations. Okay, so I'm going to go through these dashboards, which were so important during COVID. These were some that I actually included from yesterday's, and this is the Johns Hopkins dashboard, my alma mater. So of course I'm biased towards Johns Hopkins. I still actually keep in touch with all the people that I graduated with, and actually today in the afternoon I'll be talking there. But besides the point, there's a lot of, if you look at that global map, there's a distribution, and you're able to see kind of where the cases are, where the deaths are. But what is interesting, I think, to note when you're really starting to create maps is that how you decide to create the color distribution, right? So most often we think of red as, mortality maybe. We associate, psychologically certain colors with certain conditions. I'm not sure why, but like for instance, for the Diabetes Association, the color that they use predominantly is blue. So, there are all of these aesthetic considerations that you want to be thinking of when you're thinking of selecting a color for your map. It's not just simple, and maybe there's some sort of consistency that they had to maintain, right? So maybe initially the person that made the map, they said incidence will be red, mortality will be white. So then everybody has to follow suit. What's interesting is that there were so many different dashboards. There were probably 7 or 8 different dashboards that were being made, and each of them you had to kind of orient yourself with the color distribution, with the legend, and all of a sudden you were having to kind of put together yourself the information. So we had gone from few maps, very few, not much information about diseases, to so many maps out there, to so many dashboards, that it was like confusing to make sense of what meant what. To make matters more complicated, what was going on is the fact that when you're talking about incidence rates, when you're talking about mortality rates, there's a difference between count and rate. So this is an important concept, and even though it's sometimes seen as fundamental, but we all have to go back to this, right? So what are we looking at? So if it's count, and if you have a place, and I'm going to kind of characterize this a little bit more about what I'm talking about, but if you have a place where there's more people and there is a higher case count, then that doesn't really mean as much as when when you actually have a case count with denominator there. So basically, what I'm trying to say here, what am I trying to say? Adjust. You're trying to say normalize your data. Exactly. Yes. So we have to take into consideration population counts, right? What's the density? Different things. Age adjusted. Sometimes age and sex adjusted. So the research that I would be, what was the main research that I was presenting here is age and sex adjusted breast cancer incidence rate. So, and that's in the second part of the talk, but this is just, kind of going over some of the different distributions of cases and going through the granularity. Very important concept and geospatial considerations. At what level, will you be looking at the data? Will it be at the zip code level? Will it be at the county level? Will it be at the state level? These are all practical considerations that you have to think of when you're creating a map. So what I wanted to point out here, and I did I did an analysis of Pittsburgh here, Allegheny, and so a lot of this status report just shows up on the dashboard. So all you got to do is click on the county level, and you're able to get this dashboard. And let's see what this dashboard says. Is it useful help, or is it just random information? Okay, so wow. Okay, pretty good information, huh? So like, what's from the audience? I want to see, what's one thing that you are able to pick out that is helpful to you if you're living in Allegheny County, or maybe as a researcher. What is something that you would be interested in when you're thinking about, okay, right now we're thinking about both the infection rates, right, and vaccination rates, right? So from that context, you're trying to come up with a plan in your community, right, to increase vaccination rates maybe. Maybe you're trying to keep the case counts down. So what is one thing that you would be interested in finding out? Anybody? Yeah. Okay. So, is that's something. Is that information that's included in here? But derive it from there. Yeah. Good. Okay. So, anybody else? Any other information that you can get? Wanted to kind of draw your attention to this, right? The county fatality rate, case fatality rate. So among how many cases, how many deaths were per case. So that's kind of what that looks at. So, there's a lot of useful information. So county case per 100,000, again, there's adjustment for population, right? Again, 65 and older, if they are more vulnerable, that might be some information that might be useful, right? So that means vaccination rates need to be higher, in that community, because immune systems are affected more so in an advanced age, right? So these are all the things. I mean, like, this was very important, right? ICU beds, how many were utilized? Okay, great. So this shows you, location level data. This is available for every county in the United States. So some powerful analysis can come out of that. You see geospatial considerations are abundant here, and possibilities. Okay, so this is, again, kind of going into a lot of these maps in the dashboards that you were probably looking at. I wanted to show you how the granularity works. And then this is at a zip code level, one of them in Pittsburgh, and it gives you information specifically about that. So that's really, I wanted to go through that. I thought it was really important to be talking about the pandemic because, one, it's taken a toll and affected all of us, whether it's directly or indirectly, and two, the application that comes out of this and applying it to other disease conditions. So I just wanted to also be mindful of time here. So now we transition into understanding another very complex condition, which is cancer. And so this is actually a study that I completed 5 or 6 years ago. And this was kind of also at the early stages of when I was going through kind of understanding geospatial considerations. So as you can see, there's variations, right? There's variations not only in incidence of prostate cancer, but also mortality. So there's, there are these patterns that are needing to be explained. And so geospatial considerations are the way to go. Now, this is visually, I'm going to show you more concrete ways to determine if there's spatial dependence Tobler's law, for some of you that are familiar with geospatial. So, worldwide cancer epidemiology, we put together a lot of data, went through a lot of sources, SEER, and a lot of the data sets, and had this paper published. So since then, that has gotten a lot of attention, and a lot of additional work has been done from that. So that was an introduction. Now, I wanted to share with you this potential possibility of association. Why did I include this up there? Now, first of all, can somebody tell me what is this map of? Just orient yourself and kind of see if you see anything there that gives you a clue about what it's saying.
Air quality.
Good. Yes, air quality. And can we be more specific? So, yeah, there we go. So it's what is important about PM 2.5 versus PM 10 is the fact that PM 2.5 goes further down into the lungs, causing more damage. So, I got to thinking, and with other researchers, we collaborated. We were thinking, and we started thinking maybe environmental variables, maybe particulate matter has an association with cancer, because it has a long-term effect. There has been, in studies on the cellular level, connections between air pollution and inflammation and other pathological conditions within your body, right? So it was natural for us to think that there might be a connection, and we saw that in the literature as well. But we wanted to see that firsthand and see if that was indeed the case when you were considering geospatial consideration, geographic weighting. Was that still the case, right? And the second question was, were these models any more informative than the models that did not take geospatial considerations into account, right? So these are the questions that we were kind of trying to wrap our heads around, and wasn't making sense. Okay, so we explored this, and so that was environmental. Lead is another place where you can be using geospatial. I just wanted to kind of throw that in there. That's another project that I had worked on, and so that's another one. So this is another application of geospatial, and this is one that was presented recently in another conference. And the reason I included this is because this shows geospatial considerations when we're looking at other chronic diseases like cardiovascular disease, the #1 cause of mortality within the United States. So, you can see, remember at the beginning of the talk, I said that the South, there was actually a stroke belt, and I was actually, in the inception of the telestroke, the telemetry, in Medical College of Georgia, I was, kind of part of all of that and part of that excitement. And I remember the neurologist launching this as a new program about 20 years ago. So the stroke belt was something I was aware of. But then, thinking about cardiovascular disease, right? So it would naturally follow that the same area that has the stroke belt is also cardiovascular disease, right? So these patterns, these visual patterns, these recurring patterns, when you keep seeing them, you start to take note and make notes of that. So now that all you know about the stroke belt, the cardiovascular disease belt, now you'll be able to take this idea, maybe some of you, and launch off into your own research to do geospatial considerations in that. So I've shown you so far application of geospatial in health in 2 areas. One, predominantly in infectious disease, right? In COVID, I'm trying to characterize that. And then 2, you saw the application in cancer, right? Prostate cancer. And also there's applications in breast cancer and many different types. And then 3 in environmental health, right? But you're also seeing cardiovascular disease and everything else. So these are really, important to be thinking about. So, there's a lot of steps involved. I just wanted you to appreciate that. And, also the fact that how you can be using geospatial characterization, it doesn't have to be the main focus of your work, even. It could be for you to introduce the concept, to get people to be thinking that, okay, all disease, wherever it is, doesn't present the same way. This is a novel concept for a lot of people, a lot of physicians, a lot of healthcare providers, they think that, like I started with, diabetes will present the same everywhere, and that you can use the same standards and same guidelines in every community, and the community glucose levels, right, will all be controlled. But that's a fallacy. That is the argument that I'm making, We have to make sure we're getting to the community level. Okay, so, I'm going to leave the rest of this talk for some additional kind of exploration, further exploration areas that you can try on your own. What is the end time on this talk? I got 9 minutes. Okay, good. I think this is a perfect time to kind of, wrap up and leave you with some things that you can try on your own. Okay, so, I like to talk about social determinants of health always when thinking about health conditions, because one of the things that really make a difference in effectively either controlling or treating diseases or addressing diseases on a community level is you have to understand the social factors that are going on. And I'm just going to quickly say social determinants of health is one of the major sort of public health tools that we use to understand these variations as well. So hear me out. Look up social determinants of health. If we combine social determinants of health with the power of mapping, then we can make a difference in every community in the United States. So what are these social determinants of health? Well, there are 5 major ones. And, all of them are important, but one that I have really spent a lot of time looking into is economic stability. Very important. I'm not saying, I'm not saying high economic status. Or notice I'm not saying that, because there are many examples of people whose socioeconomic status has changed, and even that takes a toll on people. So, it's really important to explore the social determinants of health, economic stability. I've, also done a lot of research with my colleagues on food insecurity. One of Governor Wolf's major priorities, right, is food insecurity, and how to solve that. So that can be used at a geospatial consideration. Let's look at some of these others. So these are, there's a lot of values here, and I'm not going to go over these numbers, but there are some fundamental theories which I've been basically explaining in my examples, but this is the official way to put it. Spatial nonstationarity is a condition in which a simple global model cannot explain the relationships between sets of variables. There lies the problem, right? This is where mapping comes in. This is why we need mapping. So the nature of the model must alter over space to reflect the structure within the data. So this variation is what we're trying to capture. And I argue that if we want to improve population health If we want to improve the health of all Americans, we really need to be looking geospatially. We really need to be looking at the community level, and we need to be applying social determinants of health. So here is just some things to be thinking about. And here's another one of my visuals here on the left. So I think it kind of timed out on us. But anyway, another concept is interpolation. Again, I'm just kind of providing concepts. So if you want to write some of these down, these are techniques, real life techniques. This is used in HIV, variations, and depending on how close or how far you are to the clinic, the prevalence of HIV is estimated. In rural areas, such as Kenya, low and middle income countries, where even the areas aren't quite completely mapped out, geospatial consideration is the way. Imaging, remote sensing, trying to figure out where those roads are to get access to better care in low and middle income countries. Guess what's used? Geospatial analysis, mapping techniques. So, in conclusion, I want to say that, first of all, thank you for being such an attentive audience. And mapping really has made a tremendous difference in my life. And that missing piece, that part that wanted to make a difference from health, from helping people, from being a physician, well, that part of me was finally satisfied when I was able to see the disease prevalence and incidence in mapping and understand the complexity. Because then I realized that this is a way that we can solve these things. It's not rocket science. Let's create a map. Let's figure out the social conditions that is affecting the people. And let's create policy. And all of us, let's make a difference. Let's use mapping to make a difference out there. Thank you.
Thank you. Very thought-provoking information there. So you'll be around if anyone has any questions? Mm-hmm. Okay.
Yeah, actually, if there's a time or...
well, we've got about 10 minutes before the next presentation starts. So I would like to give everyone an opportunity to take a break if they need to, but if you will be around and they can come up and ask questions, that would be great. And then our next presentation will start at 11 a.m.